Hi, I'm Representative Kim Fawcett, and you're joining me for an episode of Fairfield in Our Town. In Our Town is an opportunity really for all of us to get to know our community leaders just a little bit better. And today, our guest is our federal representative in Washington, D.C., Congressman Jim Himes. Congressman Himes, thank you so much for taking the time to join us today. I'm just thrilled to have the chance to talk with you. As I mentioned before we started shooting, one of the reasons I originally wanted to do this show was to have a forum where the residents of my community could get to know the leaders of our community. And you have sort of an interesting story. You worked private sector and then made this huge transition into politics. And I was just wondering if we can start out just talking a little personal about your history and how did you come to decide to run for Congress?
Sure. Well, as you point out, about 12 years I worked for a bank in the private sector, and I left that in 2002 to spend about 4 or 5 years working for a nonprofit organization that did affordable housing in the Northeast. And so we would try to, rebuild urban communities that had sort of fallen into disrepair. And, I decided to run for Congress because this was 2007. When I made that decision, and you'll recall we were in the midst of the Iraq War, the Afghanistani War. We were sensing that we were headed towards an economic meltdown, which of course in the end we did. And I just thought, the government has been acting irresponsibly in the last 4, 5, 6 years. And, I got involved locally. I was a member of the finance board in my town. I live in Coscob, so I was part of the finance board of the town of Greenwich, and got involved locally and, just kept sort of working locally. And when an opportunity presented itself in 2008, I just said, I don't want to be at the end of my life and look back and say I never tried something big. So I just decided to go for it.
I really, really appreciate that because often people ask me why, or, how I ran, and I say when I'm 80 and I'm sitting in the nursing home, or 85, hopefully I make it to 85, I don't want to look back and say I wish I had tried that state rep thing.
Right.
I just wanted to be able to have at least tried. And I'm now entering my 4th term, and one of the things I've certainly noticed is an increasing partisanship. And obviously, Congress is experiencing that as well. And I guess I'm interested, and I'm sure many people are interested to learn more about your perspective from your experience being, representing us down in Washington, D.C. How does the partisanship feel, and how do you feel like, how did we get to the place where we are with the budget and the government shutdown?
Yeah, it's a great question. You and I share similar constituencies, and that most of our constituents don't want us to be that partisan. We
Right.
both represent probably roughly equal numbers of Democrats and Republicans. And what's interesting is that that's actually a rarity these days. Seats that are contestable, that are swing seats, as they say. And so you and I have, I think, kind of a unique perspective on this partisanship because our constituents don't really want us to go there that much. So what's happening? I mean, the old timers tell me that 50 years ago Congress was a lot less partisan than it is today. That a lot of people point to Newt Gingrich, who said you don't move to D.C., you stay in your districts every weekend. As soon as you're done voting, you go home and you campaign, and that created a world where people don't get to know each other all that well because they used to all live in Washington. And for better or for worse, this has been going on for a while. But then, of course, in 2008, when the economy melted down, that caused a huge amount of rage and anger and sadness and despair in the American people.
Yeah.
And if you think about what the American people saw, and we saw it right here at home in our constituencies, people saw the government, the SEC, JP Morgan Chase, Fannie Mae, Freddie Mac, you name it, fail them. All of the institutions that they took for granted failed them. And the retirement account was obliterated. A lot of people were thrown out of their homes. A lot of people lost their jobs. And there was just an incredible rage at the Great Recession. And that affected our politics. I mean, it's not a coincidence that the Tea Party got formed in that period of time and that the Occupy Wall Street movement came out of that era. These were populist movements of the left and the right. And, you add in the fact that you have an African-American president who supports marriage equality, who implemented universal health care for the first time in this country. And what you have there is you have an opposition that is going to grow up against the guy that has an intensity that we haven't seen in a very long time. And so you have you have what happened in the last 2 weeks as we talk today. Yeah. A very small group, 30, 40, maybe 50 people on Capitol Hill who say, you know what? we'll default on our debt. Something this country has never done. We will default on our debt with all the devastation that that would imply for the U.S. and the global economy because we dislike the Affordable Care Act that much. It's sort of the absurd extreme of where a very polarized system gets you. Now, the good news is, of course, I think that people look back on this shutdown and the devastation that was done in the polling numbers to the Tea Party and to the Republican Party. I think it's not, and by the way, not just the Republican Party. I mean, Americans just said the president, the Democratic Party, the Republican Party, a pox on all of your houses. But of course, the pain was borne primarily by the more extreme wing of the Republican Party. I think the good news is they're not going to run that play again. And I'm not going to tell you that that means we're going to have, perfectly happy negotiations. I hope so. But I don't think they'll run the shutdown default play again because it didn't work terribly well the first time.
I feel very fortunate to work in the Connecticut General Assembly because when I talk to colleagues around the country from other state legislatures, I think some of this partisanship that you are experiencing is playing out. But in Connecticut, we kind of pride ourselves, people don't realize it, but we have together, Republicans and Democrats, done 2 budgets over the past 4 years. We've done a jobs bill that was very comprehensive, and we did gun reform all together. And so the possibility to work together still exists, and yet it's so difficult. And I'm wondering your sort of sense when you're in Washington, do you feel frustrated or do you feel hopeful that the partisanship is something we can work through, or is it here to stay?
I sort of traced a lot of the extreme partisanship back to the anger and the emotions that grew up in the recession that started in late 2008. And of course, as the economy improves, and it's improved meaningfully in the last 4 years. I mean, we've seen, short of 8 million jobs added in the last 4 or 5 years. Economic growth has been positive. It needs to go a lot further. Obviously, we want unemployment down a lot lower than it is today. But as the economic fears and anxieties subside, politics in Washington will also subside. And people will be feeling less extreme. They'll be dealing with fewer constituents who are outraged. You and I deal with outraged constituents.
Yes.
Imagine in communities that are not as affluent as this one. Communities where there's a lot of poverty and whatnot. That creates a lot of intensity. And I do think that as the economy improves, the partisanship will start to drop away, and hopefully that'll open up room for us to do some things that we all know we need to do.
And we're eager to see Congress do it.
In exactly the tradition that you talked about here in the state of Connecticut. I mean, you guys got a bipartisan gun safety bill done, which, though it was very controversial, look, it didn't infringe anybody's Second Amendment rights. You can still go out there, so long as you're not a felon, and buy a weapon if you want to. 90% of Americans support background checks for everybody. It's not a crazy idea. We want to buy a gun, but we want to make sure you're not a violent person. Even though 90% of Americans support that, of course, it couldn't pass the Congress. And so hopefully, as our politics become more calm, space opens up for a budget negotiation, for gun safety, for immigration reform. It's going to take a little time.
So what's next for our budget process? I know we've got a few months here, you've bought some time, but what's the goal in the next couple months now that government's back to work?
Well, yes. We now, the bill that we passed that reopened the government, created a committee which was designed to start those budget negotiations. And, that's good stuff. That's what a government is supposed to be doing. We're not supposed to be arguing about whether the government should be open or not. We're supposed to be arguing over what should our budget look like and how should we pay for it. And, we've got that opportunity in the coming months. And, it's a big and complicated topic, but put it this way, clearly federal spending over time must continue to come down. The question is how fast and in what areas. So, the sequester, which people talk about, these are the across-the-board cuts that kicked in months ago, they're not very smart cuts. And so as a consequence, research for things like cancer drugs is being stopped in its tracks. There are people who are going to suffer from cancer that won't get cured because of that. So a much more tailored sense of where those cuts should be. And in the long run, the deficit is actually declining at a rate faster than it has declined since World War II. The problem is less in this year or next year. It is more 10 years from now, when the large areas of expenditure that the federal government does, and a lot of Americans don't know this, but most of the spending the federal government does is through the Medicare, the Social Security, and you throw in defense, by the way, defense and security, you've got about 3/4 of the dollar that the federal government spends. So the reason I highlight that is because, sometimes it's hard for Democrats to say this, but in the long run, a fair and equitable reform of our Medicare and Social Security systems. And by fair and equitable, I mean vulnerable people don't get hurt. That's really the best thing we could do to assure the long-term fiscal stability of the country. So my hope is that we can make some progress in that area. And then, there's so much else we should be doing. We talk about cut this and the budget that. Why do we talk about that? We talk about that not because we all love doing budgets in and of themselves, but because we want to have money to invest in the education of our kids, because we want our kids to grow up to be well-trained and start businesses and be great workers at places like GE and, kayak.com down here in Norwalk, So I'm really anxious to get to that point where we're talking about education and energy policy and comprehensive immigration reform, which of course you and I hear about a fair amount.
And I also, I spend a lot of time talking with people about infrastructure investment in Connecticut, and frustrated because I don't see the federal government with a long-term infrastructure investment plan, but I also have spent the past 5 years asking, begging, screaming, yelling to the Connecticut government that we really should have a long-term vision of what our transportation, our energy, our mass communication infrastructure is going to look like. And I'm frustrated because people want cuts, and I served on the budget committee. I know there are people doing hard work trying to find cuts, but at the same time, if we don't invest in our infrastructure and in the future of our country, we're not actually lifting ourselves up for that 10 years out. And I don't know if you have the opportunity through your work to work on sort of long-term infrastructure investment plans, but all of it seems something that we could really engage
and talk about an area for common ground, right? I mean, I don't care if you're a Democrat or a Republican or a socialist or a Tea Party or whatever you are, talk to a business person, talk to the business groups here in Fairfield County.
They're begging
you and I both, they are begging for a solution to the infrastructure and of course to housing as well, too. Because, so many of the businesses that are in Stamford, for example, where, you have very high cost real estate, they can't attract people if they need to live an hour and 20 minutes up the highway. And so, unfortunately, too often in our political world, it's spend more, spend less. The answer, of course, is spend smart. And nobody can tell me, particularly living in this part of Connecticut, that investing in our train systems, I mean, what do we have, a week or something with no trains?
Almost 2, right?
And, that was following on the heels of a train that keeled over here in Fairfield. And, I mean, nobody can tell me that investing in our infrastructure, trains, and by the way, electrical networks and data networks, doesn't set us up for economic success. And by the way, if we don't do it, it sets us up for economic failure.
Right, and there's actually really critical investment we can do in Metro North. We should talk. If you haven't, if you haven't heard it from the business community, there's a lot of investment that we can make our trains run faster and run more efficiently and change the entire economics of Fairfield County.
And run more like subways. I mean, those trains were built for a time when we were kids and everybody got on the 605 train to New York, right? Today that's not what people do. They go from here to Greenwich, or they go from Greenwich to Stamford or Bridgeport. I mean, now the whole thing needs to be a little different than it was 50 years ago.
We would hope we're going in that direction. I would be remiss if we didn't have some time to talk about healthcare and healthcare reform and the Affordable Care Act. And obviously, this month, October, was the rollout of the Affordable Care Act websites. Some of them are having some challenges, of course, being reported in the news. And I thought it was really important to start out our conversation with healthcare talking a little bit about Medicare, because I know I'm still hearing from seniors in my district, and just there's so many confusing messages out there about what specifically changed with Medicare and how seniors currently under Medicare plans are going to be impacted.
Right, good. That's a great place to start because, of course, seniors pay very close attention to this. They're often, the big users of healthcare. But here's the thing. For the Medicare population, healthcare reform is an unadulteratedly good thing. Seniors, and by the way, with the rollout of the exchanges, of course, seniors who are on Medicare stay on Medicare. They don't need to worry about the exchanges. Some people have had great experiences with the exchanges, some people haven't. But seniors stay on Medicare, and now, because of the Affordable Care Act, they're entitled to one no copay free physical a year, something called the donut hole, which seniors know about. Sometimes those of us who aren't seniors don't know about it, but this is where once they spent, once Medicare covered like $4,000, $5,000 worth of their drugs, all of a sudden they were on the hook for a couple of thousand. that donut hole is closing. So seniors will go out of pocket a lot less than they used to because of the healthcare reform bill. So for seniors, healthcare reform is really going to be a very positive thing.
What's the controversy then? Why do they feel like they're going to see a reduction in services? Do you have an explanation for what the message is that's going to them?
Yeah, absolutely. And let me just be blunt about this. There are very fair criticisms of the Affordable Care Act. I could give you half dozen of them and things that should be changed. And then the American people have been flat out lied to by the unbending and unflinching opponents of the healthcare reform. So, for example, the vice presidential candidate of the United States of America, Sarah Palin, was retailing the notion that there would be death panels made up out of whole cloth. So, people hear death panels on Fox News and they're like, my God, they're setting up death panels. That's going to cause a certain amount of consternation.
Absolutely.
Right? The other side, the opponents of this have been saying it's a government takeover of healthcare. The private insurance companies are getting millions of new customers. Hospitals are remaining in private hands. Doctors are remaining private. Nobody's going to work for the government, and yet they hear government takeover of healthcare. So the main reason people are nervous is because there has been an incredible propaganda campaign to just try to decimate in the minds of the American public this healthcare reform. Now, let me say it again. It's not that this healthcare reform is perfect. There's plenty of things that should be improved about it, but an awful lot of people have been lied to for a very long time about things like death panels, about things like, this is going to be massive cuts to Medicare, and so there's a lot of fear out there.
Yeah, it's interesting because people have lost sight of the fact that we actually 10 years ago were in crisis because we needed healthcare reform. And so many people were losing their homes and losing their life savings as they were dealing with trying to fight disease or healthcare issues.
It's the leading cause of bankruptcy for American families, is stumbling on an unexpected medical cost, the leading cost of bankruptcy. And so, there are going to be bumps, and there have been some fairly obvious bumps, particularly not so much here in Connecticut, but in the national rollout of the exchanges. The online system has been less than a smooth rollout. But look, Americans have already begun to experience a lot of the benefits. There are people all over this country whose 22-year-olds left college and couldn't get a job because it was rough economic times, and because of the healthcare reform, they were able to go until age 26 onto their parents' plans. One of the key things for the healthcare reform is the fact that previously, if you got heaven forbid, cancer, some very serious disease, there came a point when the insurance company would say, sorry, $1 million this year, you're done. We cover no more of your bills. And they can no longer do that by law. It used to be impossible for people with diabetes or even people who'd had trouble in childbirth to get health insurance on the individual markets. Insurance companies are no longer allowed to turn you away if you have a pre-existing condition. Now, the area we should talk about, which is going to determine whether this thing is successful or not, is whether we can, over time, bring down the overall costs of the healthcare system. In the state of Connecticut and at the federal level, bringing down those healthcare costs in the long run is absolutely essential.
And so the theory is that as more people go on to the exchanges and are purchasing private insurance, the costs will come down. And do you have faith or hope that that economies of scale is going to play out and we are going to drive down the cost of insurance?
That's one of the things that is designed to drive down the cost, but the real cost drivers, you and I have both spent time in the private sector. Here you have a business where people get paid not for doing good stuff, but for doing more stuff. And by the way, they're not paid by the individual who consumes the service. If they're insured, they're paid by insurance companies. So here's a system that is designed to drive volume, and that's what we've seen for decades now, 8, 9, 10% annual inflation in the healthcare system. So where you can really move the needle is if you rejigger the system so that doctors and hospitals are actually paid to keep people out of hospitals. That's sort of counterintuitive.
Yeah.
But one of the things the healthcare reforms did was it said to hospitals, look, when Mr. Smith, who comes into the emergency room every 3 weeks with chest pains, if he comes in after you've treated him in the emergency room 2 weeks later, we're not going to reimburse you for that. And what that does is, now that sounds kind of harsh, right? But what that does is it says to the hospital, don't just get Mr. Smith stabilized and send him out the door. Mr. Smith is coming in every 2 weeks because he's got some problem. Maybe he's not taking his heart medication. Who knows what it is? But deal with the problem. Keep Mr. Smith from coming back to the emergency room. So over time, those kinds of reforms combined with, by the way, wellness, right? I mean, we haven't talked
Yeah.
about that yet, but trying to give incentives for people to be healthier, that's how you're really going to keep the inflation in the healthcare business down.
I don't know if in Congress you did this, but in the state government this year, we all had to sign a wellness contract, and we have to participate in a preventative health care program, and it's part of the state trying to reduce the cost of delivery of health care.
Yeah.
So there's some problems. I mean, I think it was inevitable that there was going to be rollout problems. What now on the practical level can people do? Can they, if they're having a hard time accessing the websites, you know, are there ways to access health insurance right now if they want to, and how can they do that? And can we contact your office? I know they're contacting my office, so I want to refer them to you.
Yeah. Well, you know, so far here in Connecticut, the healthcare exchange is working pretty well. So we've got Access Health Connecticut.
Yep.
You know, they've signed up 2,500 families in this state for actual insurance. They've got about another 9,000 applications underway. So it's working pretty well. You can go onto their website. By the way, if you don't want to go onto their website, you can call them up. They've got an 800 number, and you can call them up, and maybe we can put up on screen what that number is. But, you know, people should call. It's an opportunity to shop for health insurance. Most people are going to find, particularly since most people are going to qualify for tax credits. This is a key thing. It's not what's the premium, it's what's the premium minus your tax credit. And the tax credit goes up to 4 times the poverty level. Now what that means is for a family of 4, it's about $98,000. So if you got a family of 4 and the family's making less than $98,000, you're going to get an instant tax credit to help you buy that premium, so to buy that health insurance. Now what I can't sit here and do is tell you that everybody's health insurance is going to be cheaper than it was before. That's just not accurate. You know, for years now, health insurance premiums have been going up 8, 9, 10% a year. Some people will experience those increases. Some people will experience decreases. But the point is that you'll be able to go on these exchanges, and you know, if you're comfortable online, that's the place to start. Here in Connecticut, you know, it's been working pretty well. But you can also do it in person with somebody. You can do it on the phone, and check out what the offerings are. And of course, if you're covered, most people in Connecticut are either covered through Medicare or through their employer. Right? They work for a company. Their employer provides it. Those plans shouldn't change much, if at all. But people who are in the individual market are going to have access to this exchange, and so far it's been working pretty well in Connecticut.
And I think people don't realize that, I believe it's 2015, the amount that an insurance premium can go up each year is capped. So we won't see, once it gets stabilized in 2015, does the Affordable Care Act sort of control increases in premiums?
Well, you know, the same state commissioner, you know, approval processes will obtain, meaning, you know, any insurance company that wants to go for rates needs to go to the state insurance commissioner and ask for permission. What you might be thinking of, this was another good thing that came out of the healthcare reform. The law now puts a limit on how much of each premium dollar, that's the dollar that you and I send to Blue Cross Blue Shield or Anthem, how much of that can be spent on stuff that isn't healthcare, on salaries, on advertising, on things that isn't healthcare. An insurance company that spends more than 85% on anything other than healthcare has to write you a check and reimburse you for that difference.
And is there something in place to sort of oversee them to make sure they're...
The insurance companies need to report these numbers to insurance commissioners, and if they go over in terms of spending on advertising or executive salaries, they are required by law, and it gets monitored by the insurance commissioners of each state. They are required by law to write checks to their premium, to their customers.
So that'll be interesting when that kicks in 2015.
Well, people have already gotten checks. No, that part of it is already,
immediate.
You know, people have been getting these checks from their insurance companies, and it's a pretty surprising moment in the lives of people who get these checks. Yeah.
Have any successes? Has your office helped anyone or had any ability to help people connect with new health insurance plans?
You know, where this is really particularly gratifying is for people that have had pre-existing conditions, and my God, a lot of people are out there with pre-existing. It could be something as simple as, you know, I've had a bum knee all my life, or it could be something as simple as a young woman who had a very complicated pregnancy. Those are pre-existing conditions, and those people, if they didn't have insurance through their employers, If it was affordable, it was if it was available, it would be incredibly expensive. So some of the really gratifying stories are coming out of people who thought they would never get insurance on the private market and now are able to do so. We're hearing across the board, a lot of people getting insurance for the first time. We're also hearing some people say, hey, look, this insurance plan is more expensive than my old one. And the fact is that because the law put a floor on the quality of the plan, meaning, you can't sell plans that are of lower quality, some people are paying a little more for their health insurance, but they're also getting a better quality plan. So, again, it's early days. The exchange has only been open for 3 weeks or so, and I think, 2-3 months from now we'll have a better sense for how it's rolled out.
And it's interesting you bring up the individuals with pre-existing conditions, because one of my in the first few months I was walking door to door during my very first campaign, I met a woman, so this was 8-9 years ago, I met a woman who was about 50, and she had some form of cancer. I think it was stomach cancer, but in her younger years, 15 years earlier. But because of that experience with cancer, which she had surgery and treatment and was technically cured because she had been so many years cancer-free, she could not purchase health insurance, or it was just so outrageously expensive she couldn't afford it. And she and I talked for a long time, and I remember this was all before the Affordable Care Act, and I remember thinking, is there an answer for her? And now people like her, will
be able to buy insurance.
It's amazing.
The other thing that's kind of fun about this too is that person. If you think about that person, let's imagine she did work for a company, or an even younger person who had an experience with cancer working for a company. If that person had a great idea to go out and start another company, you think they're going to leave their health insurance behind? Not a chance, right? Because they know they're not going to get it, right? Now, because people will be able to purchase health insurance in the individual market, if they've got a great idea to go start a new business that is going to, put 50 jobs here in Fairfield, they'll do it.
Right.
They'll do it because they'll be able to get private insurance.
And they'll buy on the exchange.
Exactly.
Now that the partisanship is hopefully behind us for a while, and maybe Congress is going to start to settle down with the budget. The other big issue this nation and our constituents are just screaming for us to address is immigration and immigration reform. And it's another one of these incredibly complex issues, and yet if we do nothing, we're really not moving forward as a nation. And I'm wondering where you are, or where you think the opportunity presents in front of the Congress to tackle immigration reform again.
Immigration reform, it's really frustrating because it's one of those really across the board wins. If we could get something like what the Senate passed, and remember the Senate passed a bill, I think it was with 70 plus senators, I'm forgetting now, but strong bipartisan support. It would help the fact that we've got 12 million people in this country living in the shadows, undocumented people living in the shadows. It would address the dreamer problem. These are the young kids who get brought here at age 2 and they go to Fairfield High School, and only when they graduate do they discover that they're not American and therefore they can't do financial aid. And it would be huge for the economy. The Congressional Budget Office has estimated that getting comprehensive immigration reform done would help fix our Social Security problem, because now you have more people paying into Social Security. And by the way, it would be huge for business. A recent immigrant is much more likely to start a new business in the United States than somebody who's not a recent immigrant. So this is one of those real win-wins. We got to get it right? We got to make sure that our borders are secure. But the Senate passed a really well-balanced bill. Not perfect, but well-balanced. And unfortunately, the House of Representatives, where we've got some of the more rootin' tootin' Tea Partiers who are just people like Steve King, who you're gonna do comprehensive immigration reform over his grave. We've been hung up. But I'm hopeful now that we're kind of beyond the shutdown, and hopefully tempers are calming, that maybe we have an opportunity to do something that I think would be good, really good for this area. You and I both see it in our constituencies, whether it's DREAM Act kids or the consequences of having significant illegal populations in our cities and whatnot. We could really do a lot of good by getting comprehensive immigration reform done.
And when I know when I read about immigration reform, or when you see people talking about it on the news, there's this phrase, a path to citizenship. And I'm wondering what in the legislative proposals that are out there right now, what that path to citizenship looks like. And is it even possible, because so many right-wingers are absolutely opposed to a path to citizenship?
Yeah. So, most Americans, and this is the most controversial part of the comprehensive immigration reform, most Americans say, hey, we've got 12 million people in this country that are undocumented. They're living in the shadows. They're congregating on corners, creating sort of a little bit of fear for people who are, driving in those areas. They're afraid to go to the police if they get a crime committed against them. They're afraid to go to hospitals if they get hurt. I mean, this is just not a good situation. Most people also acknowledge that we're not going to deport 12 million people. I mean, even if we had the resources to do that, what would happen to the nation's restaurants and farms and, some of these states that have put in place draconian anti-illegal immigrant laws or have their crops rotting in the fields because there's no one to pick them. Anyway, most Americans get to the point where they say, you know what, so long as this person has been law-abiding, so long as they pay a significant penalty, thousands of dollars, because they broke our laws, and we are a nation of laws, so long as they're contributing by paying taxes and paying Social Security, after a lengthy period of time in the payment of a penalty, they should be able to apply for a green card. And what the Senate bill does, it says after 10 years of being employed, you got to keep a job, after paying your taxes, paying Social Security, and staying out of trouble with the law, you get to apply for a green card. That's a pretty rigorous path. Now, some people just say,
come on in.
No, it is far from come on in. If you're on that pathway and you lose your job, you're in a lot of trouble. You can fall off that pathway. And that strikes most Americans as a fairly practical compromise. Now, again, there are those who say, we just got to find them and deport them. Well, that's just not practical. I mean, we could spend tens of billions of dollars it would actually be pretty devastating for our economy because by and large these people are largely guilty of wanting to make a little money in the greatest economy in the world, and they're working. Right. So anyway, that's a controversial area, but I think the way it's been structured in the Senate, most people would accept is a rigorous, tough path, but the one that results in a pretty good outcome.
I am really hopeful after talking to you that we're going to see Congress shift into gear and maybe make some comprehensive changes on immigration reform. I can't thank you enough for taking time to join us today. Our half hour is up,
okay.
But it is such a pleasure to have a chance to talk with you, and we're so honored and so pleased by the work that you're doing for us down in Washington. And I know you spend a lot of time away from your family, and that can be tough, but we really appreciate it, and I hope you'll get to talk more with me in the coming
Absolutely.
months.
Look, the Congress could learn a lot from the Assembly and the Senate of the state of Connecticut, so we got to do more of this.
We have our partisanship too, but hopefully we're doing some good in Washington and in your state house. And thank you all for watching today, and I hope you'll join us next month at Fairfield. It's Our Town.